Well, today we're having Ask an Expert, and we've got Katrina Jensen here. She's a nurse with Intermountain Healthcare, and today we're talking about pediatric well-child visits. What are those? Casey,
you start when the baby's born, and in 2 weeks you go to the pediatrician or your family practice doctor to start those screenings and well-child visits. They look for, if it's time for immunizations, if it's a physical, normal growth. It's really important to keep up with those.
As a state, how well do we do at keeping up with those?
Well, immunizations not so well. Well-child visits, I think people generally get to their well-child visits. Most insurances, well, all insurances now cover preventative screenings and preventative visits. So there's no reason not to get to the pediatrician or the family practice doc for those visits. So usually in that first year of life, you're there a lot. 2 months, 4 months, 6 months, 9 months.
Getting the shots and
getting
all
those shots.
Stuff,
so that's kind of immunization driven. And then after 15 months, 18 months, keep on those visits every year. Sometimes when people's kids get older, like 6, 8, 10, they kind of drop off. They don't take their child to the doctor. But really, go to the doctor around their birthday is a good time to remember, because that's easy to remember.
Yeah.
And make the appointment and make sure your child will be measured, weighed. They'll check the vision, the hearing, the scoliosis stuff, the spine.
And a lot of times,
and it's a good opportunity to ask questions.
And being preventive is the main.
Exactly.
Right?
Absolutely. And so if you don't get to those appointments, then maybe you're in with a sick visit and you don't have the opportunity to, like they have a sore throat or you think they have strep. And then those visits are kind of circled around that particular problem, and you don't get the chance to do some anticipatory guidance. The doctor can't say, okay, in the next year, these are the things you should watch for. And then as the kids get older, you have behavioral, you have school issues, you have kids are athletic, they might be in sports, you need to have those sport physicals. So it's just a good way to keep the relationship with your provider so that they know who you are and they know who your child is.
It says right here, the American Academy of Pediatrics has detailed summary on their Bright Futures page.
Yeah.
What is the Bright Futures?
American Academy of Pediatrics has a Bright Futures. It's a kind of a detailed graph, but it's really helpful if you go to it. It's a full graph of every visit that your child should get from the time that they're born to the time that they're 18. And I think it's really helpful. It's too much to talk about in this interview because it's quite detailed.
But it's a great place.
It's a great source for families.
Okay,
Bright
and
Futures.
Then is it me, or are we hearing more about whooping cough now than we have in the past?
Well, there's been an outbreak, yeah.
And is that because people are not getting immunizations?
I think it still goes back to hand washing and spreading disease and people, not being practical about sending their kids when they're sick, et cetera, to school. And sometimes that's convenient. Sometimes they can't keep the child home if the parents are working, et cetera. But immunizations are so super important. And, I know that some people are not in favor of immunizations, but we all know that that's prevention, and prevention is where it's at, as you said.
Yeah.
And it's worth $1 million to prevent the flu or whooping cough or something like that.
There you go. Well, thank you very much for stopping by. And if you got questions, of course, you can call all day today, 877-908-0680. And we want to say thank you very much for your time. We appreciate it.
My pleasure.